So the standing terminal knee extension is a great exercise to use to help get your body to walk a little bit better, to get your knees straighter when you're walking. So after knee surgery, a lot of times people will walk with their knee still a little bit bent. They'll keep it like this. And what you want is you want that knee to go all the way straight like that. And the standing terminal knee extension is a great way to help re-educate your body how to do that. So what you want to do is just get a resistance band with a loop in it, anchor it around anything sturdy, a leg of a table, in a door frame, something like that. Okay? You put your leg in the loop, get a little bit of tension on it, you don't need a ton of tension. Stand about shoulder width apart. I tell people put their hands on their hips, this way they don't try to use their hips to do it or shift around. Your other leg is going to be perfectly still. It's not going to move at all. It's not going to even bend. It's going to stay nice and straight. And what you're going to do is just let your knee bend a little bit and then squeeze it back. And that squeezing back is the important part. So let it bend a little, squeeze it back. You don't have to bend it a lot, you just have to unlock it. And again, the important part is the squeezing back. Another thing I don't want you to do is I don't want you to lift your heel up off the floor. Okay, when you do that, then you start to use a little bit more hip to get it back down, and we want to focus on the quad muscle. So keep your heel on the ground, unlock it a little bit, and squeeze it back like that. Now what I have my patients do is I'll have them hold the squeeze about a second or two, and then relax. I'll have them do that 20 times, and then I'll have them do a little bit quicker pace, 20 times. Again, this is a great exercise to re-educate your body with how to walk properly. Once you walk with a normal gait, once your knee gets fully straight when you're walking, there's no compensations there, then you don't have to do this exercise anymore. Okay? It's not really a strengthening exercise, it's a re-education exercise, and it's not one you should be doing as you progress through your rehab program. Once you walk normally, stop this exercise and you move on to other more appropriate exercises.